Yeah, so this is an area of real active interest. As I mentioned, there's a number of signatures that have been published recently that purport to be both prognostic and predictive, or prognostic or predictive, in making radiation-specific decisions. In addition, some of the previous signatures that have been developed to answer chemotherapy response questions are being applied to radiation questions as well, and it remains to be seen whether those will be useful in this space as well. But we have both those previously derived signatures that are being applied to radiation questions, and it may be useful, and we have radiation-specific signatures that have been developed and are being close to being brought to clinic that may really help guide those decisions. I think the biggest challenge in adoption is just really making sure that these tests do what we think they do. That is, anytime you develop a test, you have to apply it to different patient populations in kind of a blinded way, or run clinical trials that ask the question, does this test that we think give us information about response to radiation or lack thereof, does it really do that repeatedly, reliably, over and over again? So we need to test for validation in additional patient populations. And we also need to assess the clinical utility of these tests. Is it really helping patients in the end? And so the barrier to adoption is the completion of some of those validation studies. They're underway, and we're starting to look at those now. But before this is ready to be adopted in the clinic, we have to make sure that the tests do what we say they do. We've done that clinical validation, clinical utility testing for signatures that predict response to chemotherapy. There are some signatures that predict response to endocrine therapy that are currently undergoing those same validation and utility studies. For the radiation question, those studies are now ongoing in terms of validation. That's the barrier. So once those show that they do what we think they do, then they'll be ready for clinical use.